All right, let's put on our detective hats for a bit. Today, we're diving into a real medical mystery. The case? It all starts with a persistent lump, and it's going to take us on a journey through the incredible, intricate logic of modern medicine. You know, every great medical mystery starts with just a single clue. And for our 55-year-old patient, it all began with something that seemed simple enough, a lump in his neck that just wouldn't go away. But here's the thing, it wasn't just the lump. Our patient came in with a whole trio of symptoms that were, pretty hard to ignore. We're talking a constantly blocked nose, nosebleeds that just seemed to come out of nowhere, and of course, that persistent lump. So, these are the core clues we've got to work with. Okay, so we've got our initial clues. Now the real diagnostic journey begins. Let's follow the exact steps that medical professionals take to turn these symptoms into a solid, definitive answer. So the first physical exam right away confirmed what the patient was reporting. The doctors didn't just find the enlarged lymph nodes in the neck. They also found a suspicious mass hidden away in the nasopharynx. That's the upper part of your throat, right behind the nose. Now, the diagnostic process is super methodical, very precise. First up, a nasopharyngeoscopy, basically a tiny camera, gives doctors a direct look at the mass. Next, a CT scan creates this detailed 3D map of the whole area. And finally, the most critical step of all, a biopsy, where they take a small tissue sample to see what's really going on at a cellular level. And this is that moment of truth in any diagnostic mystery. All the tests had been run, all the evidence has been gathered, and the lab has the final answer. The diagnosis is squamous cell carcinoma. So what is that exactly? It's a cancer that starts in those flat epithelial cells that line the nasopharynx. Because these cells are always dividing, they can sometimes be more vulnerable to becoming malignant. So now that we know what it is, the investigation shifts to an even bigger question. How do we treat it? Knowing your enemy is really only half the battle, right? Now comes the big strategic decision. How do you fight it? This is the treatment dilemma. So I want you to think about it for a second. Based on everything we know, the specific type of cancer, and crucially its location, what do you think is the best course of action here? We've got 5 potential paths on the table. Surgery, radiation, chemo by itself, just watching and waiting, or maybe even antibiotics. Each of these has a rationale, but only one is really the most appropriate choice. All right, time's up. Let's dig into the clinically recommended path for this patient. And, more importantly, let's understand why it's the right choice. And the answer is B, radiation therapy. For this specific cancer, in this very particular location, radiation is the #1 most effective treatment. The clinical consensus here is crystal clear. For nasopharyngeal carcinoma, radiation is the go-to treatment. A big reason for this is that squamous cell cancers are generally very radiosensitive, which is just a fancy way of saying their cells are more easily damaged and destroyed by radiation compared to other cancer types. Understanding why the right answer is right is one thing, but figuring out why the wrong answers are wrong, that's just as important. It really sharpens our clinical reasoning. So here's the deal breaker. It all comes down to location, location, location. The nasopharynx is a really complex and delicate spot. It's just packed with critical nerves and blood vessels. Trying to go in there with a scalpel, that's incredibly risky and could lead to some serious complications. Radiation, on the other hand, can zap those cancer cells with incredible precision, all without invasive surgery. Okay, so what about chemotherapy? Chemo is a vital tool for sure, especially for more advanced cases, but it's typically used to support radiation, not replace it. Think of it like this. Radiation is the targeted airstrike on the main tumor, and chemotherapy is the ground force that helps clean up any cancer cells that might have spread. The last 2 options, well, they're much easier to cross off the list. Simply observing a confirmed cancer is never the right call. Time is absolutely critical. And antibiotics, they fight bacteria, not cancer cells. It's just the wrong tool for the job. Simple as that. If you take away just one single thing from this whole diagnostic puzzle, let it be this. The #1 factor that drove the entire treatment plan was anatomy. Where that tumor was located determined absolutely everything that came after. And that's what's so amazing, right? This one single case, this one patient's story, it goes from just a simple lump to this incredibly sophisticated treatment plan. It really pulls back the curtain on the complex, logical, and frankly, life-saving thinking that drives modern medicine. It's a great reminder that it's never just about finding the disease, it's about finding the absolute best way to fight it.